Thanks, Sally. Yeah, and can I echo Sally's welcome to everybody? It's nice to see so many of you here. I know you haven't got your cameras on, but we usually do that because the signal doesn't really work very well when we have too many people using their cameras all at the same time. So that's why they're turned off. So I just wanted to talk a little bit today about the creation of the Echo Training Programme. So this was something that was set up in 2019 when I first joined the school. My background is as a cardiac clinical scientist, so I've been an echocardiographer for many years. So this is a programme that's very close to my heart. Next slide, please, Sally. So I'm sure you all know this already, that Echo is a vital diagnostic tool. It's safe, it's economical, it's reliable, it's portable. You don't have to take the patient to a huge machine all the time. You can take the machine to the patient. It gives us structural and functional information about the heart, and it plays a vital role in many healthcare pathways. Next slide, please. So these are just examples that I've taken from the BSE website of indications for echocardiography. And it's, as you can see, really important in so many different pathways, both cardiac pathways and non-cardiac pathways. So it's a really important tool that we want to make sure that everybody has access to when they need it. Next slide, please. Back in 2019, when the programme was being set up, we had a number of challenges that we were trying to meet with this programme. So we knew that there was an existing shortfall in cardiac physiologists, cardiac scientists, echocardiographers, lots of different terms for the same role. But back in 2019, we knew that there was around about 363 whole-time equivalent Band 7 cardiac physiologist posts that were vacant and being advertised across England, which is a huge amount, really, when you think about the amount of people who actually do the job. We also knew that there was an increasing demand for echocardiography. So not only did we have a shortage of people to do the job, but the numbers that were being asked to do were going up. So there was an ageing population, which always means that there's increased comorbidities. We need to have more diagnostic tests. All pathways start to grow when you've got an ageing population. There's also a really exciting time for new and improved treatments. So there was lots of new treatments coming out. There was different types of valves being used to treat heart disease. There were things like Herceptin was very up and coming at that point. So in oncology, there were new treatments that required scans of the heart on a regular basis to make sure that the drugs weren't toxic to the heart. So there was kind of loads and loads of new reasons why we were doing echocardiograms. There was also decreased mortality, so people were living longer. Things like congenital heart disease, lots of other illnesses were being treated more successfully, so people were living longer with conditions that needed regular echoes. And it was estimated that there was around about a 6% increase in demand every year pre-COVID-19. So it was quite a challenge for us to keep up with that. At the same time, there were also a lot of quality improvements happening. So 7-day working was beginning to be introduced in a lot of hospitals so that people had access to an echo 7 days a week. I don't know whether you've heard of that, but that's a form of departmental accreditation. So there were lots of standards that departments were achieving at the time that took extra time and took some work to achieve. That was also adding to the workload. And the NHS long-term plan came out, and that was also a driver for the programme because it advocated for community diagnostic centres. So it wanted to increase the diagnostic workforce, have it much closer to the patient, and that again required a lot more people. And the other thing that we found a bit of a challenge then was insourcing. And I think this is probably still a bit of a challenge now, in that a lot of departments have to pay locum agencies for people to come in. That's got its good points, certainly for the people who are working for those insourcing agencies, because they have greater flexibility in their time of working and their pay can be higher. But it also can have some challenges in that the departments aren't able to progress people who are working for agencies. They're not going to move up the bands. It also stops a little bit of continuity because you get different people coming in on different days, and it definitely reduced training capacity. So we were struggling to get trainees places to be trained to do echocardiograms. So all this was leading to an increase in waiting lists, There was a lot of regional variation at the time as well. So depending on where you lived, waiting lists were very different. It increased the workload and it increased the stress of a lot of the people working in echocardiography. It also reduced the number of diagnoses and the time it took for them and the treatment to happen, and it made the patient's experience worse. Next slide, please. Existing training in echocardiography at the time, there were two main routes that we had formal training in. But the National School offers two different types of training. So there was the Practitioner Training Programme, which is the undergraduate BSc in cardiac science. This is a programme that's some of you may have been through, and it's a great programme, but it suffers from a lack of uptake. Not enough trainees are going through it to provide the workforce of the future. And there's a number of reasons for that, which are a bit difficult to get on top of. There's not as much visibility. So when you're at school, you know all about nurses, you might know about physiotherapists, you certainly know about doctors, but you might not have heard of a cardiac physiologist or a cardiac scientist. So it's difficult to get people to take the degree because they haven't heard of it. People who are doing certain healthcare professional degrees like nursing, physiotherapy, have access to the Learning Support Fund. And that gives about £5,000 a year to help with the fees. And our trainees on the PTP weren't getting this at the time. It requires training capacity for placements, so there's got to be a lot of departments that are willing to take people on for placements. And importantly, it's only an introduction to echo, so it requires significant hands-on training and experience post-graduation. So most people who come off the PTP, if they go into echo, it takes them at least 3 years to get trained in echo because they're doing that alongside another role, maybe in the cath lab or 24-hour tapes. So it can take a very long time to get trained. The other programme that we offered at the time was the Scientist Training Programme. This is a 3-year postgraduate master's degree programme, and it has a very broad curriculum. So it allows both in-service and direct entry trainees in, same as the ETP. So some people will come in having worked in a department for a while, and some people will be straight out of a degree at university. So because of that, there's a lot of overlap in the content between that and the PTP. So it's very broad, and there isn't a huge amount of time spent learning echo. The choice of the specialism isn't till the final year, so there's only about a year where trainees are actually doing echo full time. Training capacity, again, is required, so we don't have enough departments who are able to take on STPs. There's a lot more people who want to do the programme than we can find places for, so that's a bit of a shame. And because there's only about a year of echo in the final year, BSc accreditation is not one of the outcomes from it. So most people don't get to the BSc accreditation at the end of the programme, and they have to have further experience beyond it. Next slide, please. So at the time, we were seeing a massive rise in the number of STPs, particularly in cardiac science. So you can see that the line there that's much higher than the rest is the one for cardiac science compared to all the other physiological sciences within the STP. So cardiac was really popular. We could see that there were people wanting to do this, but we were limited by the number of training places that we had. Next slide, please. So we set up the Echo Training Programme, which was much more focused than the STP, and it was quicker. And it was incorporated as a fast-track way to get echocardiographers into the workplace as quickly as we could. Next slide, please. So to complete the programme, it's a little bit like the STP in that it has 3 final components, but they're slightly different. So all trainees on the ETP have to complete a postgraduate certificate in clinical echocardiography. And that's the academic underpinning knowledge that you'll need to become an echocardiographer. At the same time, you're doing an e-portfolio of workplace-based assessment. So basically that means that you're applying the knowledge that you're getting at university into tasks within the department to show that you're actually applying that knowledge in the correct way. And then the final examination for the Echocardiography Training Programme is the BSc accreditation. So that means that within the 18 months of the programme, you will need to take both the theory part of that and take a first attempt at the practical assessment. Now, you don't necessarily have to pass that practical assessment. The BSc process allows for a resit of that. So we've built that into the completion requirements for the programme. And if you do need to resit, there's an opportunity for you to do that beyond the programme. It's also worth mentioning here that the postgraduate certificate in Echo is 12 months of your programme. And if you don't manage to pass that within that 12 months, according to the university rules, it might mean that your place on the programme finishes because you're not able then to get your 3 final requirements. So it's important that you think of all 3 of these requirements equally importantly. You have to pass all of them to pass the programme. If you do pass them all, you get a certificate of completion of the programme at the end of it. Next slide, please. So because we knew that 18 months is quite a short time to get BSc accreditation, normally people take a bit longer than that, and we were able to put in some levers to help support ETP. So the first thing is that it's a full-time funded supernumerary programme. So trainees are having their wage paid by NHS England, and that means they're extra in the department. So they should be in Echo full-time. They shouldn't be doing lots of other jobs at the same time. There should be 5 days a week. One of those days being study time, but all your time as a trainee should be concentrated on your training. And that's important to make a fast track programme. We made sure that we integrated the academic and work-based training. So all the syllabus that's been created is very integrated between the academic and work-based, and it's all on the same curricular page. And you can see from that how closely those two work together. NHS England also agreed to fund some sessions for training officer time. So as a training officer, generally you don't get any dedicated time to do that role. It's just fitted in on top of your normal role. So we offer some extra funding to try and make sure that those training officers were able to do the job really well. At the time also we were able to fund some regional practice education facilitators, also known as training coordinators. The funding for that hasn't been renewed as much this year, so there's less of them around than there were originally, but they did a fantastic job in the early days of this, of sharing practice, supporting trainees, and those that are still here are doing a really, really good job. And we also worked with the BSc to try and make sure there was sufficient BSc practical assessment sessions at the right time so that everybody coming off the programme could get a place when they needed it. And that's been very successful as well. The BSc now do 2 days at the end of March instead of just the one they used to do, so they get a lot more trainees through. And we were also able to fund some simulators that are spread out across the country that you may or may not get a chance to use, but those are an excellent way of kickstarting some of the skills you need to be an echocardiographer. Next slide, please. So the numbers on the trainee programme are nice and steady. We've got them up to a high number. When we started the pilot in 2020, we had 12 people on the programme, and we thought we'd get about 20, but we've been really lucky. We've managed to get about 65 every year, and that's holding steady at the moment. So if you're one of those 65 this year, well done. Great to have you here. Next slide, please. So I just wanted to mention some of the outcomes. The number of people who pass is very high. The vast majority of people pass. We do get the occasional person who leaves, and that can be for a number of different reasons, often personal issues. Sometimes the programme isn't what they thought, so they leave. We do get some people who fail. Not everybody passes it, but it's quite low numbers. And then we've still got some people who are active on the programme, and that's from the 2023 programme. The people would have finished in April, should have finished in April this year, but there's a number of people who've got extensions. So it is possible to get an extension if you have particular challenges, if you have an exceptional reason why you might need longer on the programme. We have a process by which you can ask for that extra time. And that's generally things like illness, bereavement. We also have policies for parental leave. So if any of those things apply to you, if you want to get in contact with us, we can support you through that process if you need it. Next slide, please. So we've learned quite a lot over the 4 or 5 years that the programme's been running. We know that it's ambitious, but it's definitely attainable if you have the support, planning and hard work that's necessary for it. And I looked at the reasons why people didn't complete, why people failed the programme. So the non-completion, as I mentioned, there's a lot of people on EEC or maternity leave, another 9 still to complete this year. In the early years, we had some challenges with training delivery where our trainees weren't treated as supernumerary. So they struggle to pass. I think that's something that we've addressed, and the departments understand what's expected of them now. But if you find that you're struggling with that, again, let us know and we can try and help you, support you through that. A couple of people haven't managed to get their BSc accreditation within the programme itself, and that's usually because they don't take the theory early enough. So we do suggest that you take the theory exam at the first opportunity, because that then allows you a resit if you need it, and you've still got time to complete the programme. If you don't take it early on, then it just means that you're too tight at the end of the programme. So although you might think that it's a bit of a challenge to do your theory exam in 6 months, it's not. The vast majority of people have passed at that point. So that's what we recommend. And also we have a few challenges with one file, in that some people don't get that finished in time. So again, that's another thing that you need to be thinking about. Make sure you get it done. But the numbers that fail are still very low. They're not particularly out of sync for any kind of a programme like this. Next slide, please. So over the years that we have been running the programme, one of the things was to try and get the number of vacancies filled. And currently, in the last stock take, which was 2024, so it's a little bit old now, there were only 222 vacancies for whole-time equivalents at Band 7. So I think we're making some progress on that one, but there's still plenty of jobs out there. So it's great to have you all in the programme, and hopefully you can take up some of those jobs at the end of the programme. Next slide, please. So once you finish the programme, great, you'll be qualified as echocardiographer, but just a few thoughts on what happens after you've completed the programme. Next slide. So the important thing to remember is that even when you've passed your BSc accreditation, you're still very, very early on in your career. And I remember when I passed mine, it seems like a million years ago. And you don't know a lot at that point. You need to do a fair amount of consolidation. So the BSc say that accreditation is a minimum requirement and cannot be regarded as a guarantee of competence. And I think what you need to think at that point is that you've got the skills required, and it's a bit like learning to drive a car. You pass your test, but you've still got some learning to do and some confidence to build so that you're able to do that job really well. So it's important really that you think about where you get your first job. Make sure you're getting a job in a supportive environment where people can help you to continue to develop like you have been doing as a trainee. I just mentioned insourcing and the community provider charter. The BSc has now got a charter with most of the insourcing companies, whereby they don't take you on immediately passing your BSc, because they recognise that consolidation still needs to happen. So it's best really if you spend time in a department that can offer you the support you need once you complete the programme. Next slide, please. There's a register now for specialist echocardiographers. So the Academy of Healthcare Science runs a number of different registers, which are really important to show that people who are working within the NHS meet the right standards for training and for continuing professional development. This is something that it's great to have to prove that you are meeting all those standards, and it's in addition to BSc accreditation. And if you get your certificate of completion for the programme, you can go straight onto this register. So once you get that, this is the next step that you do. You apply to the academy and get onto a register. Next slide, please. CPD that I just mentioned is really important. It's essential for personal and professional growth, making sure that you remain competent and up to date in your field. And it's a number of different ongoing learning experiences that you will go through as you develop in your careers. And it's required to maintain both BSc reaccreditation and registration with either AHCS or the Healthcare Professions Council. So CPD is really important, and hopefully that will be built into your careers as you move on. Next slide, please. And this is a quote from the new 10-year health plan. So this is the latest health plan that the government have come out with to make sure that the NHS meets the challenges of the future. And one of the commitments they've got in there is that they want to ensure every single member of NHS staff has their own personalised career coaching and development plan, helping them to acquire new skills and practice at the top of their professional capability. So I think this is a fantastic aim. And I hope it is something that's happening in every department over the next few years, making sure that everybody really is helped to attain what they can achieve in their career. Next slide, please. So some of the things you might want to do once you've got through your accreditation and you've consolidated a bit, you might want to get involved in training. So training capacity, as I've mentioned, is limited in the departments. Because everybody's so busy, it's really hard to find the time to train, but it's a really rewarding thing to do. So as an echocardiographer, I've had the opportunity to train all these different kinds of people. You know, I've worked with people on PTP, STP, ETP, cardiology registrars, anaesthetists, nurses, people who are training in-house, and also international recruits. So there's loads of different people who want to come and have a career in echo, and it's nice to be able to work with all these different types of people. Next slide, please. Assessing is another thing that you can get involved in later on, and that's through the BSE on the TT practical assessment days. That's another really rewarding thing to do. And the National School of Healthcare Science also, we have people who help us assess our trainees as they come off their programmes as well. Next slide, please. I mentioned registration with the Academy of Healthcare Science. As you progress further in your career, you might want to think about STP equivalence, and this is a way to get statutory registration, so it's at a higher level than the Academy equivalence, so it's much more at a postgraduate level. And for this, you would show that your training, education, knowledge, experience is equivalent to the STP. So it probably will take further training and experience beyond the programme. The ETP is only 18 months, so it's not going to be equivalent to the STP, but you can make up that learning within the department through your career. Next slide, please. And beyond that, there is also our higher specialist scientist training programme that you might want to think about in the future. And this is a doctoral level 5-year programme, and it takes people up to the level of a consultant clinical scientist. So just to let you know that that's there and available for people as they progress through their career, and it's a really rewarding programme. Next slide, please. You might get involved as you move on in physiologist and scientist-led services, so things like stress echo, transesophageal echo, specialised clinics, you know, rapid access chest pain clinics, valve clinics, Herceptin, heart failure, all these things are available in departments and are likely to be open to you as you progress through your career. So it's really worth being in those departments, really getting yourself embedded in them and thinking about what your career development is as you go along. Didn't want to show my favourite photos. It's one of my favourite places. Yeah. This is in Scotland. It's one of the mountains up there. And this is what I always think. When everything feels like an uphill struggle, just think of the view from the top. So it's when things are hard, it's worth it because you'll feel such a sense of achievement at the end.